Good morning, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a podcast series Nurturing Bonds Experts' Insights on Breastfeeding. This podcast series aims to educate and support breastfeeding mothers on their families and their families. This year's theme is Closing the Gap Breastfeeding Support for All that resonates deeply with our mission to provide comprehensive support and awareness for breastfeeding mothers and in all their diversity. To celebrate this week, today we have with us our guest, Professor Dr. Suvarna Khadilkar, who is the president of Mumbai Obstetrics and Gynecology Society, MOGS, Deputy Secretary General and in charge of website and IT initiative Foxy and an endocrinologist and gynecologist. Not just this, she has been recently appointed as the chief of World FIGO Committee on Menopause, appointed as deputy editor in chief of FIGO Journal, that is the International Federation of Gynecology and Obstetrics, IGJO, that is International Journal of Gynecology and Obstetrics, that is very rare position for an Indian to reach at that height of a position, and also appointed as scientific advisor to FIGO Conference 2025 Menopause Society. Welcome to our show, ma'am.
Thank you. Thank you so much, Simran.
Thanks a lot, ma'am, for taking out time for this special initiative by Voice of Healthcare and coming to our episode. Ma'am, I have a lot of things, and to start the conversation, I would like to start with, can you start by sharing why breastfeeding is so crucial for both mother and the baby?
Oh, at the outset, I really want to thank a Voice of Healthcare for having me here and taking on this World Breastfeeding theme for the discussion for this podcast. It is very, very important for both mother as well as the baby. For the baby, there are multiple nutritional benefits. Like it contains the right kind of combination of various proteins, fats, vitamins, and minerals, and it is easily digestible for the baby, and it is right for the baby. Like if you have a preterm baby, the mother produces milk that is just correct for the preterm baby. If it's a full term baby, mother produces the milk that is right kind of milk for the full term baby. So breast milk also contains anti-infective antibodies, so when they are passed on to the baby, and therefore it prevents infections. As against the top feeding, we often find that the infections, diarrheas are very common amongst the newborns. And the breast milk also has right kind of calories, nutrients, and it also has, it prevents lot of adult diseases. You know what that by that what I mean, that it is found that the breastfed baby is the best fed baby. In the sense, the breastfed baby gets all the nutrients that prevent obesity, type 2 diabetes, and cardiovascular diseases in future. And the physical closeness during breastfeeding is so important, and it fosters emotional bonding between mother and baby. That is so important, and the baby feels very safe and cozy in mother's arms, and it is so beneficial for the baby's emotional and social development. Besides, there is one contained in the breast milk, that is the DHA, which is very, very important for the development of the brain of the baby. So when the brain develops with breastfed babies, they have found that they have higher IQs than the babies which were not breastfed. Is it not very important that you should all consider exclusive breastfeeding for first 6 months? And it is not that it is only important for the baby, but it is very, very important and beneficial for the mother also, because it means that there is a faster postpartum recovery and can reduce postpartum bleeding, because every act of breastfeeding, it induces a hormone which contracts the uterus, and so it will decrease the amount of bleeding that takes place after delivery. It also helps burn calories, which can assist. So in fact, the girls or ladies or the women who breastfeed the children, they remain in better figure and shape. They maintain the figure better than those who do not. So they have good postpartum weight loss, and it is linked to a lower risk of breast and ovarian cancers. It is so much of a great health benefit for the mothers. So also, while the mother is breastfeeding, it acts as a natural contraception. So what is called as demand feeding, and as and when baby needs, if the mother feeds, and it's not strictly 2 hourly or 4 hourly, then this type of demand feeding is very beneficial, and this leads to suppression of ovulation, and it acts as a natural contraception. So mothers do not have their unwanted pregnancy as long as they are very efficiently feeding their children. And of course, it takes a lot of economic saving for the whole family. Breastfeeding is so cost effective compared to formula feeding, isn't it? So, and it is a significant financial burden for the family otherwise. So this is the main advantage for the mother and baby. Thank you so
Wow,
much.
ma'am. I really these are the some facts and explanation which you have just given to us. I didn't know about this, and I believe this is a new learning, some great insights for the new mothers to be that how helpful breastfeeding it is for them, their family, and especially for their baby as well. Thanks a lot for sharing on that, ma'am. Ma'am, moving on to my next question, what do you think are the some common challenges that new mothers face while breastfeeding and how can they overcome them?
Yeah, so I think there are multiple challenges. First of all, the obstetrician's job, like us, when a patient is registered with us, we have to prepare her for lactation. We have to explain to her, especially the first time when they are pregnant or the first pregnancy, they are not having any experience of lactation before. Like second and third pregnancy, they already have experience. So these first moms are very very important to focus on, and we have to educate them and prepare them mentally and physically for lactating their child. And after delivery, they are already gone through so much of pain of delivery and all, so they are not really much of willing to start the lactation immediately, but they are reluctant. But it is our job that to explain and educate them. The first, as soon as the baby is born, it is our regular practice that we put the baby onto the mother's breasts and ask the mother to take and be very close to the baby. That brings and sets the lactation properly, and this is the importance. But if they don't do, and the first few drops are most important, and they are very very highly concentrated with the antibodies, and which is like a vaccine, you can say. It is so effective, so you don't miss out that initial colostrum that we call, and the baby gets that colostrum, and the baby will do very well. But there is a lot of latching difficulties. They have pain, discomfort, and they initially always the milk supply is low, so they feel no, they are not getting enough milk, so they are reluctant. They get a lot of work and social pressure, so they don't know how to feed. If they are going for work, how do they give the breast milk, which is we are encouraging 6 months exclusive breastfeeding. Government has already sanctioned 6 months of maternity leave, but some of the mothers in private setting and all, they have to go and work. So for them, we have so many solutions. If there are any latching difficulties, it is like there are lactation experts who can go and help them. So they will exactly teach them the technique as how to latch, so that properly the entire areola has to be sucked in inside the baby's mouth, and then only the feeding will start, and it will be maintained well. So this is how the difficulty should be solved for the latching difficulty. If there is pain and discomfort, you you have to see if there are any sore nipples, engorged breasts, mastitis. So all these problems can be there, and if they are there, then you have to first take care of them. Use some creams, and generally we don't advise you washing frequently. Just once in 24 hours nipples can be washed. And if there is of course infection, engorgement, then due treatment has to be given, and address the signs of infections if there are any. And if there is a low milk supply, so this is actually a kind of myth. Some of the girls who are like women who are very very nervous about feeding, and they have a feeling, oh no, my milk is not sufficient. But and they stop feeding well. If the latching is not good, the milk supply will be less. The more efficient is sucking, more increase the milk supply will happen. So this is what you have to educate them, explain to them. And most of the times the milk is sufficiently produced by women, and you have to first tell them that, look, some of them say, "Oh, my breasts are small, so I don't think I can produce enough milk." So that's again a difficulty that they think, and that difficulty is in the mind. So it doesn't mean that smaller breasts produce less milk. In fact, they will produce efficiently, and they will have a proper established lactation if the baby latches the breast very well. So I think there are problems, we have solutions for each of them. And nowadays we have multiple lactation consultants who can help these girls. We have multiple WhatsApp groups, support groups, where they ask all these problems, their mothers, they are discussing, and the lactation consultants, they advise them what to do. And we have the working mothers, for them we have breast pumps, and you can extract the milk and store the milk in the fridge. So that's a wonderful way of giving the breast milk when you are away from the baby. So these are the various solutions, Simran.
And I think, ma'am, you explained all the challenges to us in very simple manner, in a layman's term, so that every mother can understand and can, go through this journey and with a relaxed manner as they know how to overcome these things.
Yeah. So one
Ma'am,
more thing I wanted to tell you, Simran, that these mothers require a lot of family support, and most importantly, the mental support. I should not say, but such times the mother-in-laws in the house, they keep telling their daughter-in-laws, see, you are not producing enough milk, and that mentally causes a lot of stress to the mother. And then they again start going away from feeding, and they want to give the top feed. And if you give the top feed, the baby gets a easy kind of spoon feeding, and they would not learn proper latching and proper sucking, because sucking is an effort that baby learns. And the baby learns that unless the baby sucks, it will not get the milk. So but if you give by spoon, it knows that it's getting a very easy way. The milk is being fed, and spoon fed babies will not suck well. So mental health of these uh, women is very important. They are very prone to go in postpartum depression, so we have to particularly look at this.
and I think that's a new fact coming out, and thanks for explaining that as well, ma'am. Ma'am, I would like to ask what steps can be taken at the community and policy level to encourage and support breastfeeding among new mothers.
See, that is what I told you, that as a president of MOGS, like World Breastfeeding Week like this, we have a concentrated, focused efforts for promoting awareness. So we have, for example, like today, we have one lactation awareness program at one of the hospitals, that's Kama Hospital. Another one is at Saifi Hospital. The third one is at Nair Hospital. And so many other workshops are being conducted, where we gather all nurses, the women who are attending the hospital, and we try to teach them in practical way, demonstration. We have role plays which we are already set in our society's website, we have already put up. So these role plays also help, because then mother-in-law comes and says, no, no, you don't produce milk, or you don't do this, you don't do that, eat so much. Unnecessary overfeeding the mothers also is not good. So all these things we have to educate them, You have to maintain the balanced nutrition. And see these promotional videos we have, and we have such a fantastic social media today, which we didn't have olden days. So we can immediately have a video, and kind of it can go viral if it is giving you right kind of message. So we make use of, now MOGS is having a website, we have all social media, and we regularly put our all the messages which go down, and they are visible to the global audience, we, our women, our members. So you can go on our site and see. Today also we will put some videos and promotional messages on this thing, which lactational promotional messages will be there on the social media. We have WhatsApp groups, all these problems are discussed. They of course, but they have to be, consultant has to kind of endorse the problems or give the exact correct way of managing them. Because the women can discuss anything with each other, but it has
Yeah.
to have a proper scientific basis. So the lactation consultant's role is very important here, as well as the obstetricians and the society like MOGS, Foxy. And we are the biggest society of the Foxy, that is we have 2,500 members. So if each one of us starts creating awareness, I'm sure the awareness will go down to communities.
You said it right, ma'am. Ma'am, as you are the president of Morgs Society, so I believe you guys would have some key priorities and goals for the organizations as well. I would like to know how do you guys are working on that set of goals.
Yeah. So before that, no, Simran, I just wanted to also address some of the myths that are very
Yeah.
common with breastfeeding. Breastfeeding is too painful. It's normal to experience significant pain, but it is not painful at all. It's the most smooth and painless kind of this thing. So you have to remove these certain myths. You can't breastfeed if you have inverted nipples. There are ways to breastfeed with we have the nipple shields, we have breast pumps. So certain myths which are very common amongst the communities, we have to really get them removed from the minds of the women. So breastfeeding alone isn't enough, we'll always need a supplement with formula. But I can tell you some of the babies, yes, some of the instances, but they are very rare. And these instances are such that the breastfeeding is not sufficient, and the best way to measure is whether the baby is gaining weight or no. If the baby is not gaining weight, then it is an alarming situation, and you have to consult the pediatrician and the lactation consultant. But another myth is that breastfeeding will make your breast sag. So that is also again wrong. It is not, sagging doesn't happen with breastfeeding. In fact, the overall the calorie loss is there, so breast will not sag, it will maintain its tone. And there are so many other myths, like you can't drink alcohol. And it should, I think, alcohol should be avoided as a whole. And so many other things, they feel that you get fatter if you feed the babies, your shape will be, you will be disfigured, especially those who are models and all, they don't want to feed. So such things shouldn't be there, shouldn't you have to remove all the wrong concepts from your mind. So that is what I wanted to tell you before I could give you something more about my organization. So our key priorities and goals for the organization are many. So our primary this thing for having healthy mother and healthy baby, that is our motto. Because we don't want to tax the mothers, and we don't want to put the mothers into under stress, that we push them into peripartum depression. So our goal is to have these mother and baby duo in a absolutely healthy, happy state. So we have seen that I would like to say that we want to increase the breastfeeding rates, provide support and counseling for these mothers. And on a larger this thing, because Foxy, we are a part of Foxy, which is a national body, and as a MOGS, we are the largest member body of the Foxy. So Foxy has 45,000 members across the country. So as a whole, if Foxy also does this job of creating awareness. So we have various modules that we have prepared for various lecture series. Now today's workshop also we have different lecture series which we have prepared for the nurses as well as the women who are attending the hospital. So we have must try for advocacy and for policy changes. For we should ask for maternity leave, breastfeeding accommodation in workplaces. There should be a side room where they can have a kind of babysitting available, and they can go and breastfeed their newborns when they are at work. So support public breastfeeding protection laws and policy, all these are there. Push for breastfeeding education to be included in healthcare and school curriculum, because nobody teaches them what is the correct thing, because they are open for all kind of misconceptions and myths. So we are here to raise public awareness, promote breastfeeding friendly environments, and we also promote research and evaluation on our platform of emojis. So this is a overall that steps that we are going to take, and practical role play, and I already told you the street plays also we do for educating public at large.
And I think, ma'am, your organization is working in great direction, educating, creating that awareness to the general public so that they can be aware of their health and their baby's health as well.
Yes.
Also, ma'am, you manage multiple roles as an endocrinologist, gynecologist, and leader. So, how do you balance these responsibilities, and what advice do you have for others in the similar position? Because I know this is not easy to handle.
I agree with you, but as you start working hard, many opportunities come your way. Like people identify you as a great worker, or they identify you that yes, this particular doctor is going to put her whole heart into whatever work she's doing, and more responsibilities come your way. So I'm sure all of you, all the viewers also must have seen this experience, that those who don't work, they never work, and those who work, they will go on working. And likewise, the if there is a destiny, then you will start getting opportunities, and you will go up the ladder and secure important positions in life. So I have a advice in such a way that, like, we do not think that, I say always believe in one fact, that the busiest has most time. So you can't see, and I've seen many people sitting at home, and if you are asked to do work, oh, I am very busy. Now what are they busy for, we don't know. But if you are busy doing 24 hours practice, and then you are doing all the education, you are doing managing the journal. I was editor in chief of the Foxy journal. I was treasurer also, so I was managing the entire account of Foxy. That's a national body. So, but if you are asked to do one more job or additional duty, I used to willingly take it, because I found that you learn to manage your time. You
Yeah.
learn, your efficiency improves. As you go on getting more work, and more work is put on your head, you start improving your efficiency, and the time taken by you earlier would be longer, but after you get 3 4 tasks to be done in short time, your efficiency automatically increases. So my advice is, don't say that no, I can't take it. There are some people who say that I would like to focus only on one job. That is the way they are. And if you can't do multitasking, and I believe multitasking is the key of all women. If you take men and women, more of women are multitaskers, so they handle so many things simultaneously. Don't you agree with me? So
I
as
agree.
against, if the men, they don't want to do multitasking, they have focus on only one job or one goal, and they follow that. So this is what I have been doing, and currently I am having multiple positions, and I God gives me strength to do all of them efficiently. I thank God for that.
We hope, ma'am, that God gives you a lot and lot of strength so that you can do the good work and continue the good work that you're doing. And you said it right. The words are coming directly from the leader who is handling a lot of leading positions in the country, internationally and nationally also. And you said it right. The more work we do, the more efficient we become, and we learn from our experience in the work we do. So it helped me a lot personally. Also, the words you just shared with me, it understood by understanding that how my work will shape me. So thanks
Thank
a
you so
lot
much.
on that, ma'am. Ma'am, my last question to you is, what is your vision for the future obstetrics and gynecology, particularly in the areas you specialize in, such as puberty disorders, menstrual disorders, and menopause management? As you are also appointed as Deputy Editor in Chief of the FIGO General, chairs of the World FIGO Committee of Menopause as well.
Right.
On
So,
that.
as editor in chief, deputy editor in chief of the international journal, and the menopause chair of WIGO, and also being an endocrinologist. See, I was a hardcore obstetrician till the time, about a few years ago, and then I gave up obstetrics. See, obstetrics is a branch which is full of challenges, and it is a branch of full of emergencies. And then, when you are practicing obstetrics, there are a lot many calamities, or you can say emergencies that you face. And there are a lot of, the doctor's safety is at its stake when you are practicing a high level obstetrics. So my vision is, I want to give them safety. The obstetricians, they should have peaceful mind when they are treating their patients, when they are delivering the women. They should not be at the gunpoint that, look, anything goes wrong with my patient, will kill you. Then the patients can't be treated well by the doctors. So at MOGS level also, and at Foxy level, we have a cell which works for violence against doctors. There are many incidences you must have seen. If there is a mishap happens, no doctor will purposely do any mismanagement. So there it such happens, and if there is any mishap, then always patients feel that, or relatives feel that, the doctor was at fault. So my vision is that such incidences should stop, and the gynecologist should have be, and this particular branch is the highest, for such incidences. So we should have a safe environment for the doctors to practice. And in my branch, that is relatively non-emergency branch, like puberty disorders, menstrual disorders, and menopause management. And my vision is that government takes up the midlife health as the priority, because we have adolescent health at government level, we have pregnancy care at government level, but we hardly have anything for the midlife women and menopausal women. So I, as a chair of FIGO committee also, I will take it globally as well as in our country, to make sure that some of these projects and some of the schemes are there for the midlife women, who also face a lot of problems. They face depression, they have osteoporosis. So all this should come in our national schemes, so that our midlife women, and they will live longer. Then anyway, our longevity has increased over the years, so it has gone beyond 72 years, but it should be much longer, with due care and support from even government as well as societies like ours.
That's great, Mama. And I believe if your vision is brighter, and it will help our country to grow in healthcare system in a better way, which we are doing already, but that will
Yes.
make our healthcare future brighter. And thanks a lot for all your efforts you're putting, and you have put in since the start of your career, and you're looking forward for that. And thanks a lot for coming to this episode and sharing your insights. We have taken a lot of your time, but thanks a lot,
Thank you
ma'am.
so much, Simran. It was a pleasure.
Thank you, ma'am.